Worldview Tube, a Brannon House television network.
The Tamara Scott Show. Tamara has served as the state director for one of America's largest pro-life, pro-family public policy organizations. In 2007, Tamara was named one of America's top 10 most influential kingmakers by the Religion News Association. Tamara has spent years proclaiming and defending the values of a Christian worldview that is the foundation of our constitutional republic. And now, here is your host, Tamara Scott.
Hey everyone, welcome. It is Monday. It is July 28th, 2025, 728-2025. And we thank you for joining us every Monday through Friday on the WVWTV.com network, WorldviewWeekend.com. You can go to Worldview Tube, WorldviewTube.com, and see our programs. Now, many of them are complimentary to you for about 7 days after we've aired them. And then they go behind the paywall. And that paywall helps fund the network. If you are a member of that paywall, that vault, you can get incredible shows, not just ours. I mean, the guests that God allows us to get are groundbreaking. A lot of times we have information, as Brannon talked about last week with Dr. Heidi Klesick and myself on his show. We were talking about the very sensitive emotional issue of organs being removed, organ transplant protocols and procedures taking place while patients were still alive. And in some cases, Dr. Heidi Klesick has reported that some of those patients not only survived, but have gone on to live lives in full recovery. But how many did we not catch with the protocols that are there? The HHS did an investigation, and now it's coming to light. And you now see on Facebook a Todd Starnes, a Glenn Beck, with their little colored screens catching a highlight like clickbait to get your attention. We're thrilled. It's drawing attention. That's what Heidi wanted when she started this quest several years ago. My point to you, we were talking about it several years ago on this show with Dr. Heidi Klesick. And so when you go to that vault, worldviewtube.com/vault, when you pay that membership, it is well worth that dollar and whatever the cost of the dollar is, and the dollar cost is, and then you get not just our show archives, but every show on the network is available to you. Brannon's shows, Brannon's 35 plus years of information, documentaries, conferences are available to you. So it's really a great arsenal for you to have at your fingertips. All right, so today, as you know, we talk about the headlines. Our motto on the show is helping you live God's Word in today's world. When the headlines hit home, we don't get caught up in them, because we learned, if nothing else, 5 years ago, if they could keep you unsettled, if they could keep you fearful, if they could keep you vulnerable, then you were malleable and they could control you. We want you focused. God's got a plan for you. Whatever the situation is you're going through, He's got a plan and a purpose for you, for good, not harm. And so we want to keep you focused. We talk about those headlines, but we also maintain our course of action so you can do what is best for your family, your freedom, and your future. And we help arm you with that information. We tell you to weigh it out, pray it out, and then decide and discern for yourself. But don't get caught up like a ball in the pinball machines back in my day. That dates me, I know, where you're just going from one paddle direction from another, just being shot across, reacting, not actively moving forward. So joining us today, the fourth Monday of each month, Dr. Molly James joins us, and we are always so happy to have her. You can find more information about James Clinic. You just do a search for jamesclinic.com. Molly is one of those cheerful people that cares about her community. She's a board certified in general surgery and critical care medicine. She saw the need for a more integrative health approach, and she combined her expertise to create the James Clinic. And she brought in and she simplified healthcare experience, keeping it personal and compassionate so that you as patients can enjoy convenient, accessible care with a direct physician-patient relationship without conflicts of interest. Exactly what you've been looking for. And we are pleased to have her join us every fourth Monday of the month. But also, you know, when North Carolina had their issues with the weather just about a year ago, she took a team to offer help there, the field care in helping health needs. And then with the recent situation, she's just on spot trying to do what is best for communities that are in need. In fact, we'll let her tell you about her Starlight initiative when she joins us. Before we do, headlines over the weekend: Greece and Turkey on fire. And we mean literally on fire. If you're like me, it's a little bit concerning. I know the tinfoil tiara I want to pull it out. All of these fires. So Greece continued to battle the major wildfire across the country, a severe heat wave. Firefighters have brought many outbreaks under control, but as of Sunday, they are still fighting. Record-breaking temperatures in the 50 degrees Celsius, which I did a quick little search. That's about 122 Fahrenheit was what I saw. And so that is in Greece, and so Turkey as well. The forecast ministry, and if you'll go scroll down through there, Thomas, thank you for pulling that up. If you'll just scroll down a little bit, there's another very orange photo of them fighting, and I believe that is in Turkey. Near Athens. Their forestry minister, Ibrahim Yamaki, said Sunday that areas affected by the fires were going through risky times and that he thought it would be several days before they were fully contained. So all kinds of issues here, so you can at least keep it in prayer, but I just wanted to make it aware we're having, phenomenon here that seem unlikely. They are there as well. And then what else? Wednesday, we'll be talking, as I just mentioned to you, the things we talk about on this show before anybody's ready to hear them. We did that with trafficking, human trafficking. Well, in 2008-9, when Obama was in office, might have even been a little bit later than that, but Mary Holes joined me from the Tea Party in Texas. We were warning about their plans to just allow anyone with a child in their party across the border illegally, no questions asked, no issues, because they had children. We warned then that you were putting a target on the backs of those children. We've seen it now in some of the reports that are coming through on hearings. We'll talk with Mary Holes about that. We'll also be talking with her husband, Dale Holes, about the central bank digital currency, what may be happening there with the crypto. I don't understand it all. All week, I am learning about new things out of my comfort zone, but this is my classroom, and I learn right along with you. Tomorrow, joining me will be someone talking about the battery storage. We'll be talking, again, I'm learning. You may know more than I. Tune in. We'll see where we're at on that. All right, Molly James, Dr. Molly James, thank you for joining us on the Tamara Scott Show.
Hi, Tamara. I'm glad to be here. Happy Monday.
Thank you. It's been a little bit since we've had you on. We have Memorial Day, so we missed that fourth Monday. In June, you were busy because you were moving a clinic from one location to another. We're happy for you, and we hope that you were expanding your care. And so we missed you that month as well. You want to tell us anything that's gone on in the meantime? Anything you want to update us on?
Yeah, if you're not following Starlight Initiative online, please go do so. We have our inaugural fundraiser coming up on Saturday, September 13th. We are going to have a casino night, and it's going to be a beautiful dinner. It's going to be dancing. It is in St. Louis, but a fun night out and goes for a good cause. We're going to highlight our partners that we work with, YAPAC, Remnant Ministries, a number of organizations. We're less than a year old, and now we've helped in North Carolina with the hurricanes has been our main effort. We also helped a little bit in Virginia in the subsequent floods, and we've been called to help in St. Louis in the wake of those tornadoes. So we didn't help directly in Texas with the floods, but we did have contacts on the ground, and our partner organizations were there doing that. So lots of things going on, and heavy reliance on individuals in a time of crisis. Government just cannot meet the needs. So that's what Starlight Initiative is here to do, to fill that medical gap, mostly for the responders.
And let's remind our viewers, it is the private class that should be handling many of these situations when we get into a crisis or a charitable situation. It's the church and the Christian that should be doing these. That's what the Bible tells us to do. This is not the citizen or the government's job. This is the private charity and the Christian fund. And there's reasons for that. Accountability, dealing with fraud, transparency. And so I appreciate that you've given folks one more option in this area. All right, so let's hop into it. Today we're going to talk about healthcare costs, healthcare insurance cost, ever increasing premiums, and maybe the quality care or the causes behind all these increases. Thanks for bringing up this topic. I've wanted to discuss it for a long time, but it is way too deep, way too big for me. So thank you for broaching it with our viewers.
Yeah, this has been a debate at our family dinner table. My mom's been an insurance agent and my brother for decades now, and selling health insurance and dealing with these struggles. So we debate back and forth a lot about the role for that and what it really should be. And I think it's important. I think there's a huge paradigm shift right now in people purchasing healthcare. COVID brought to light how the system is not for the patient. The system, if you are not the one providing the financial resources, paying directly, the physicians, the healthcare professionals are responsible to the payers, which is the insurance companies and their employers. And when push comes to shove, they put those priorities over your priorities as a patient, which is completely unethical and against everything we stand for as physicians. So we need to start there, and then we can work our way through how the different facets of this really are not serving patients well.
So when you say if you're not the one paying, is this where the third party comes in? Because I did a show, probably 20 years ago with someone who said, employers providing insurance has not helped us. People think it's a benefit, but it's allowed the cost to go up, because if you had to go to an insurance agent across town, you would be more competitive because there's that third party paying for it. The cost is not something that's as competitive, and the coverage is not something that is as good or offered as many options for the individual as would be when it was individuals buying it. Do you agree with that?
I've actually heard the opposite on that, which is employer groups really distribute the cost across a population that's more healthy because they're working. And so your employer groups are actually, I'm not an insurance expert, this is just what we've discussed over the dinner table, that's actually your better value, as opposed to individuals who don't feel they need insurance and opt out of it. And then only the people who feel like they need health services or are in a bad position where they think they're going to spend less if they pay for insurance than they would for directly buying healthcare, and you have healthy people opting out. So that's a debate. And I think another important facet to this is if you draw the parallels to auto insurance.
Yeah, hold on on that analogy. I'm watching the clock, so we need to go to break. We'll come right back to that one. Stay tuned. Okay. And with Dr. Molly James, we're talking about the convoluted subject of healthcare and healthcare cost. The Tamara Scott Show.
You woke up with a sore throat and a low-grade fever. You know you are getting sick, so here's your choices. You can get sicker and miss work. Try to see a doctor this week, or sit hours in a crowded waiting room at urgent care.
I have a smarter option for you. Open your medical emergency kit. Match your symptoms to doctor-recommended prescription in your booklet and take the right meds now and get well faster.
This is not a first aid kit. It's like having an urgent care in your home. It includes doctor-prescribed medications to treat over 39 medical issues like respiratory infections, strep throat, pneumonia, UTIs, and more.
No waiting to see the doctor and no standing in line at the pharmacy. It's right here.
Every home should have at least one medical emergency kit, and here's how to order.
Go to worldviewhealthcare.com. Your kit to treat dozens of common and serious illnesses is rushed to your door. worldviewhealthcare.com. That's worldviewhealthcare.com.
The emergency kit available at worldviewhealthcare.com. Make sure you don't have to go to urgent care. I got pneumonia. I didn't have to go. I took this last year. Stayed at home. Went to bed.
And as you know, we always offer you the little collagen elixir in this slender little sachet. Looks like a beauty product, and maybe it is, but it's so much more with this powerful supplement of collagen. Casclaw and astaxanthin got the award in 2022 for cognitive function, and in 2023 in the sports arena for active ingredients, nutrition, and format. You can go to Tamara, TAMARA.BellaGraceGlobal.com. Tamara, TAMARA.BellaGraceGlobal.com. There you'll hear wonderful benefits and results that viewers like you, our friends, have noticed. You'll see before and after photos. You'll see product information. You'll see more of their product, like their skincare system, which is one of those things that I thought might be a luxury I would never do. But after trying it once, I was so impressed with the way my skin felt when I applied it, and the way my skin felt all day long, that I continued to use it. Again, Tamara, TAMARA.BellaGraceGlobal.com. See how you can feel better, better joint health, improved mobility, improved immunity, improved stress management, endurance, less fatigue, muscle recovery, mental clarity, focus, and gut health. Just a few of the things that viewers like you noticed. Tamara.BellaGraceGlobal.com. Why? Because we want you feeling your best so you can fight for your family and your freedom on the front line. All right, Dr. Molly James is joining me today. We're talking about healthcare cost, healthcare insurance premiums, and the quality of care. So you were just about to make an analogy, and I want to give you the ability to do so.
Yeah, so if we think about where insurance came from, it was to disseminate the cost across a healthy population for those unfortunate enough to have an illness. Take type 1 diabetics, for example. It was never to pay for routine things. So the analogy is your auto insurance. Your auto insurance is there for major catastrophic issues. It doesn't cover your oil change or your broken windshield or the dents and dings along the way. So if we shift our thinking about our healthcare, we should be paying for our maintenance things. We should be covering those kind of costs because that's just part of being healthy. That's part of investing in your own health and making sure you're being proactive because everyone has the exact health that they've invested in with their time and energy. So if you think about that, maybe you need to shift what you're investing in effort or financially to improve your health.
And I like what you're talking about, the major cost or crisis care or catastrophic health event. Some people are talking about it that way and likening it to your car. I think you did. The issue for me is that insurance seems to allow all these costs to come up. Obamacare. I remember Michelle Bachmann warning that costs would increase with Obamacare. And boy, did she get poo-hooed, pilloried, and booed. And yet, I think that we could see where she was actually correct. Now, some of those folks would say, oh, no, it didn't cause premiums to go up. That they say the premiums weren't up because of ACA, the Affordable Care Act, but they were indeed had increased because of healthcare costs going up. Well, Dr. James, in anything else, whenever we see the government subsidize it, say a student loan or colleges, all the colleges do is raise their admission fees and it comes right back and hits the individual again. Is that what we saw with ACA? Is that maybe it wasn't the increased premium per se, but it was the healthcare cost going up because they knew it was going to get covered?
I think there's a multitude of things that ACA did. First of all, they mandated coverage. So every single individual had to have maternity care. Not everybody needs maternity care. And I think before that, people could choose selectively if they felt that was something they needed on their plan. We also saw the mandate of transgender care. And you saw the explosion of these clinics that are exploiting mentally ill children and adults that basically create a lifelong customer that accelerates the cost of care. Mental health, which we could argue on a whole episode about that. But again, that was mandated as part of this. So when you start throwing everything in that has to be covered, yes, you're going to raise costs. But on the back end, they also increased regulation. So if you look at some of the charts, the growth in administrators, mid-level administrators, hospital administrators, that is where the explosion of cost has come and that regulation that came with that. I remember 10 years ago, I talked to a family practice physician that said they spent $75,000 a year on their electronic health record, which is mandated. So it forced these regulations, which also forced tracking of all of these things, because when you electronically prescribe, now it goes into an electronic database and can be data harvested. So there were a lot of downstream things from Obamacare that has added exponentially to cost.
All right. So, Thomas, if you could go, there is a link to an X post from Team Reality CT. Team Reality CT. It has a graph on it that I think talks about the rising administrative cost and growth in administration compared to some of the other costs there. There you go. Molly, do you want to talk about this a little bit? I think you just mentioned it, but let me see if this is from the Bureau of Labor Statistics and the Kaiser Family Foundation. So.
Yep. If you look at the bottom green line, that is the growth in physician costs over the years. When you look at some of the different line, healthcare spending, administrative growth is the red line at the top and all of the pink. So that is where basically 80 cents on the dollar is going to the overhead to manage your care, where if you go outside of the system, 100% of that or in 90% of that is going to go back to you, the patient. So this is something you need to know as you buy healthcare is not only is it more expensive, it is more cumbersome. More people have access to your data and information because HIPAA is not protecting your privacy. It's allowing them to sell your data, but you're also getting a doctor or a clinician who is beholden to their employer before you, for example, threatened that if they prescribe ivermectin, they'll be fired, which I have personal accounts multiple times of physicians telling us. So this system has gone out of control in so many different ways.
All right. I have one more X post I want to put up, Thomas. It's the one from Rita Rabbit. Rita Rabbit, this was actually a reply to the next thread that you sent on X. Thomas, can you put this one up? It's the CEO salaries for Molina, Centene, UHG, Humana, and Elevance. It's a photo that I sent to you. It's a photo that I sent to you in the email. There you go. Go ahead and put that up if you can. Molly, I don't know if you saw this one, but if you can see the highest paid CEOs at U.S. health insurance in this is 2023, by the way. So let's see. We're dealing with some pretty expansive profits here. We haven't even talked about the profits of the insurance companies. And I don't want to be insensitive here, but remember, we had someone involved with insurance companies that was actually shot last year. And I was disappointed and disheartened by the response of many on Facebook, social media, because they almost were so angry at the cost of insurance that they almost felt like this was justified. And I couldn't go there in anywhere way. But it just seems like insurance companies executives are making so much money when families are hardly able to afford their premiums right now.
Yeah, and a lot of that anger goes toward the nurses and the physicians that are taking care of patients because they're the ones in front of the patients, and there's a misperception of where that cost and expense is going. But when you have people in power and people making decisions that are going for seven-figure bonuses, and they know I make a lot of money giving the COVID shot, and I make a lot of money when patients end up on a ventilator and get remdesivir and die of COVID, and you allow them to make medical decisions for an entire healthcare corporation, there's a major problem with that because one would have to have pretty pristine ethics to withstand scrutiny, especially knowing what happened during COVID and how the incidence of death in people who were admitted to the hospital were admitted to the ICU approached 80%, and the same physicians practicing as an outpatient had a 99.5% survival rating. Now, lots of arguments in that, but there was a conflict of interest at play, and non-physicians were making medical decisions that impacted thousands of people in those healthcare systems.
I'm going to ask you something, and we didn't talk about this, just so viewers know, when you come on this show, I ask, there are attorneys who say you don't ask a question unless you know the answer or you know the answer you want. I just ask because I just want to know the information, and you may not have the answer here. When we recently had healthcare issues with family members in ours, we got an up close look, and we're very grateful for those who gave the care, very grateful. But it became evident that many people, one, didn't have the ability of the nurses 20, 30 years ago. If it weren't for the machines that automatically did the blood pressure, a lot of these, I don't think some of them were nurses. I think they were, I don't know what their titles were, but if they couldn't have run it by themselves without the machine, right? It's like the kids at the fast food store that can't count back change. They only know what the machine tells them to do. Then somehow in the conversation, someone mentioned that administrators are going to school to get administrative degrees for hospitals, but they've never been a doctor or a nurse. How does that impact care, Molly?
Yeah, it does substantially. So first of all, we can talk about the quality of nursing care ad nauseum. give me an old school nurse who's been around 20 or 30 years any day of the week. That's who I preferentially like to have on my team. That's who I wanted with me in the ICU when I was taking care of sick patients. Now you can go straight out of nursing school and jump right into the ICU without that clinical acumen. This is scary, to say the least. And again, I used to work nights in the ICU, which is about the highest pressure point you can have. And usually your head nurse had 15 to 20 years of experience. Now it's less than 2 years. So this eventually is going to roll downhill. This is going to impact outcomes, because in those split-second decision, you need somebody who's been there multiple times to make those choices. When you look at what they're teaching in nursing school, they're worried about pronouns and what's your gender, and do you know how to click in the chart so we make enough money? Those priorities have superseded the hands-on skills such as placing Foley catheters, taking pulses, knowing how to take blood pressures, knowing how to do the things that patients need at the bedside. So this is a huge problem that is still coming to fruition.
Well, thank you. And again, we're not in any way attacking those in the healthcare profession. It is a hard profession to endure, a lot of hardship emotionally and a lot of hard hours. But what we're talking about is overall, I think it's like teachers. We love the teachers we know, the teachers from our neighborhood, the teachers who have our kids, but they're in a system that has been corrupted. And I would say maybe the same for this in the healthcare industry as well. All right, we've got to go to a break. I'm really quickly going to pull in our Numi for everybody. We offer this again because we want you feeling your best. Numi, NEUMI.com/TTSS, NEUMI.com/TTSS. Lavenders for ladies, anytime in your journey. If you're on a hormonal supplement, you might just check with your doctor, though there are none in the NutraSwish as well on their own. The blue is for everybody over 18. It has the glutathione, which helps you with detoxing. It helps detox heavy metals, forever chemicals, graphene oxide, one of those chemicals we all learned about 5 years ago. And it also helps detox glyphosate, which is a concerning ingredient in ag products, or those that some of you might even have in town in your garage. This helps detox, so a very good plus there. And then the mango-colored bottle for your mind, your memory, and your focus, whether it was from a virus or a vaccine. Many have had concerns over that. When used with the blue bottle, the mango bottle together, the results were so good that the American Brain Council apparently wrote something so positive it appears as an endorsement. For more information, you can go to Numi.com, NEUMI.com/TTSS. Why? Because we want you feeling your best, and that's why we offer our product, and you help us when you use the / with TTSS. Right back after this network message.
Hello, I'm Brandon House. I want to thank you for all your support at WVWFoundation.com that helps make possible pushing out 24/7 content for free. Without your support, we'd have to put it all behind a paywall. But thanks to you and your support through our foundation, we're able to push it out for free as a broadcast service and broadcast ministry of WVW Foundation. Please consider going there and setting up an automatic monthly contribution, or go there and make an occasional contribution. If you prefer to support us through the mail, you'll find our mailing address there at WVWFoundation.com. You can also call and make your contribution over the phone by calling 901-825-0652. That's 901-825-0652. Again, all these details are available at WVWFoundation.com. Thank you for your support as we try to help people around the world understand the times through the lens of a Christian worldview.
All right, I'm talking with Dr. Molly James. We're talking about increasing costs in healthcare, increasing costs in premiums, possibly quality of care. And so, Dr. Molly James, I know that this is your heart to help people. We see it. We see it outside your medical clinic through your Starlight Initiative. So we know that your heart, and thank you for what you do. All right, so what's the next part of this? I did some checking back with the ACA, the Affordable Care Act, and I do believe that it is now showing that it has caused issues with our health care, as you say, unfunded mandates, other issues. And we know this year some of the subsidies are going to run out. Let me see if I can go very quickly. Thomas, in one of the articles I found on this when I was doing a little bit of research on the Bachman pushback, let's see, it's the article of NPR, which is, not ever going to just help us out in any way, but it said if healthy people opt out, the insurance, which they expect this year because the subsidies will run out, the insurance pool is left with those who cost insurance companies more, and people can't go without healthcare insurance because of chronic conditions and expensive medication. So that's why the insurance companies are already asking or requesting their state regulatory authorities for opportunity to raise those fees next year. Molly, I can say from personal experience, I have not had a claim in a decade or more, other than I did do an elective eye surgery this year, which I paid heavily out of pocket for. And I keep getting upped on my increase. I'm a single person on a policy. Families, I don't know how they're doing it, but if more people opt out, like you say, the pool is going to be diminished of those who are healthy. This is not going to help the cost.
Yeah, what we need to do is push people to, again, pay for their own health care and use this only for catastrophic, build up your HSA funds, your health savings account. I like those much better than the FSA, the flex spending, because those have rules attached to them. But when you have a health savings account, that's your money. You can use it for braces or contacts or supplements or infusions or whatever you want to do. So that's going to be important. And again, people are finding out, I always say a lot of people don't understand their insurance because it's a little bit complicated, and they don't have people like my mom who take time to explain it to them. And so they think this little insurance card is their Black Amex card. So probably the reason your healthcare costs are going up is because other people are coming in and using that card. And then think of the system. So this is why my first practice went bankrupt. I worked for 2 years and didn't get paid from insurance. So you have to file the claim. The claims get kicked back automatically. You have to go and resubmit the claim. And then you get paid about 50% at 90 days. And then the billing company takes their percentage out. So the healthcare institutions have inflated their costs. You're paying a professional fee. You're paying a facility fee. You're paying a technical fee. People don't understand paying cash up front is a very transparent, and using this like a Black Amex card on the back end, you're going to get these surprise costs to account for all this bureaucracy in the system. It's very expensive to run a hospital. It's very expensive to provide care with these kind of regulations over it. So that's just, a good example. I had a patient who had an echocardiogram that we had ordered, and she went through the system and it was $7,000. We could have gotten her the same procedure for cash for about $550. So when you look at clinics like mine, we advocate for patients, and we generally end up saving people much more money than they spend with us, which is a point that often gets lost.
So how can a patient say, I'd like to pay cash, even if you've got good coverage? How can you say, I'd like to pay cash for that? So, or how can you ask, what is the cost if I pay cash? Rush Limbaugh did that, remember? When he had some type of a heart issue in Hawaii one time, and he said he could pay out of pocket, and it was I think a fourth the cost. Yes.
I usually find, especially on labs, it's 10 to 15% of the cost. So you get a $2,000 lab order, you get $100, $200 bill at the end, and they're like, oh, insurance covered 90%. No, you would have paid $200 if you didn't have insurance. So this is the false impressions that we're finally trying to break through for people. I had a patient get a thyroid prescription. It was supposed to be $1,200 a month. I got it for them for $100 for 3 months. These are the kind of massive, you just have to know how to play the game better to navigate. And you ask a lot of questions, and you ask a lot up front, and you research for yourself, and you don't get intimidated by the price of things. Because again, an echocardiogram, one would think is several $1,000s because that's what we've been told, but $550 is pretty reasonable for a test that you need.
So I'm going to come back to that NPR article. The Republican Study Committee 2025 fiscal budget said the enhanced subsidies only perpetuate a never-ending cycle of rising premiums and federal bailouts, with taxpayers forced to foot the bill. The chair of the Senate Health, Education, Labor, and Pension Committee, Senator Bill Cassidy, Republican from Louisiana, last year urged Congress to reject the extensions, saying the subsidies hide the unsustainable skyrocketing cost of Obamacare. So there, I vindicate Michelle Michelle Bachmann on this. Michelle Bachmann on this was absolutely right, spot on in 2011 when she was warning about this, as so many things. And then the Congressional Budget Office, and this is in the same NPR article, estimates that 8.2 million people who get ACA insurance now will become uninsured over the next decade due to the expiration of the enhanced tax credits, along with the other changes that the Trump administration and Congress have made to the marketplace, to the regulations in the big, beautiful bill. So I think that most of us would agree these shouldn't be the rest of us as taxpayers are trying to put food on the table, gas in the car, and provide for our children. And so I don't think that it's government's job to keep taxing us on this. As well, I'm not sure if I'll find the article, but there was sloppy paperwork, and a lot of the folks that were getting coverage were not necessarily eligible, i.e. could have been illegal.
Yes. So illegals on the rolls is one major issue, and there's a lot of debate about that on social media, but people have brought the receipts, and there absolutely have been illegal aliens on Medicaid rolls. We also know, I think there were 20 or 30 million able-bodied Americans who are exploiting that system. And what that does is the people who really need it aren't going to get it because those funds get depleted faster by people who have no business getting Medicaid. And when you look at the salaries that you were showing, a lot of those companies service Medicaid patients. They're taking the fat off the top. And if you look at the care that Medicaid patients receive, they don't have access to a lot. Everything's a prior authorization. Everything's a hoop to jump through. And this should bother everybody. I know firsthand Medicaid patients, if they do not get vaccines in the offices as they're told to do, they get booted and fired out of those offices. So they are at a financial disadvantage because if the family can't afford outside of the system options, they're forced to get vaccines and they're forced into the care that the government requires due to vaccine policies and all this nonsense that, again, have no place in an ethical medical system.
All right. And you sent a link to a X post, Thomas, if you want to go. I think it's the very last post for us. But this is on the text of maybe the fraud that was taking place with Medicare, and the insurance model is collapsing in real time. So there's, yes. And so the text right above that, Centene is down 61%, Molina is down 55%, Humana lost 300,000 or 300 a share, United Health down 46 year to date and under federal investigation. Comments on that, Dr. Molly?
Yeah, we see when we're pulling the fat out of these systems, the impact that it's having. So this is fraud, in my opinion. This is companies, again, coming in and offering a service to people on the humanitarian side of it, that they're taking the fat off of the top, and it's not sustainable. If you remove the fraud out of that and you remove the inappropriate use of taxpayer dollars, these things start to fall apart.
All right. So then I know we're going to go to break here in about 4 minutes, and then we've got another 8 minutes after that. Do you want to get to the care itself? You hit on the fact, and we saw it firsthand this last spring, our healthcare is great if you have a crisis, a catastrophe, an emergency. Great in America. But if you're just needing recovery or healthcare, it is sick care. And Dr. Molly, we saw it in one of the finest establishments. They would come in and do things with the diet, with the menu, with the testing, that would cause results that were not normal for the patient. It was almost as if they were setting up a record of ill health.
Yeah. You can look at everything in a hospital, from the food that they serve, which is disgusting. The diabetes education, they tell you to eat carbs when you are carb intolerant. That is called type 2 diabetes. They're not using ketogenic diets. None of it is best practice. Unless, again, you have an emergency, in which case the system is designed for emergencies. The system is designed for traumas, acute strokes, heart attacks. That's what the ICU is for. It is not for management of chronic disease, because we still haven't acknowledged things like, again, low carb ketogenic diets. We haven't discussed the role of nutrients and nutrition and detoxification and things like that. We still don't recognize the gut in a lot of what we're doing, which is so basic and fundamental to healthcare. every day I see people who are rolled down a system and their thyroid is improperly treated because the system doesn't like certain types of thyroid medication. So people are hypothyroid for years and years and years, and they get to us and their cholesterol is high. They may be on a statin, and really we've missed the root cause. So the only way to reduce the cost of healthcare is to get back to root cause medicine, integrative medicine, where patients are actually getting better, reversing their disease, losing weight, and learning how to live a healthier life.
Absolutely. We just keep drugging the symptoms. And then when those drugs don't work or we have side effects, we add another drug on top of those drugs to deal with the side effects. And people are getting unhealthier and unhealthier. You mentioned the term statin. Sometime can we do a show on statins, because I have been investigating this and I don't see any reason someone would want to go on statins. Am I wrong?
Yeah, that could be a whole hour show. So again, most of statin use is due to misdiagnosis. Again, when I see somebody with elevated cholesterol, I'm going after diet and I'm going after thyroid, and that leaves about 10%, 90% of my patients resolve their hypercholesterolemia based on that. So this knee jerk, you need a statin. This knee jerk, you have cancer, you need chemotherapy, you need radiation. These knee jerk reactions need to stop. We need to have thoughtful dialogue. We need to have comprehensive evaluation and assessment before we're dropping into just default knee jerk medicine.
All right. Anything else on this particular subject before we go to our...
The last thing I want to point out is in the system. I mean, there's some good doctors in the system, and I can tell you they're getting really, really burned out because their patients aren't getting better. They're getting overworked and underpaid, and the pressure's on more and more all the time. When you go to a doctor in the system and get that 5-minute visit, they're billing you between $1,200 and $2,000 an hour. So I want you to think about and contextualize the advice that you're getting versus that hourly rate. And is it that valuable? Because you look at a DPC, a direct primary care, an integrative medical clinic, you're going to feel it more out of pocket, but the value you're going to get in the information provided and the recommendations provided is going to pay dividends over your lifetime.
All right. And we're going to take our next break here. I want you all to stay tuned. We'll come back with the last and maybe what you can do. I'll ask Dr. Molly because I know for a lot of you, it's not so simple. You can't just not be on insurance in case one of the kids or somebody has something catastrophic. You've got to have insurance coverage. But she's giving you some advice. Pay for the small things you can pay for. And we'll talk more about that when we return, as well as there's a new medical school in Arkansas I want to mention. Stay tuned. The Tamara Scott Show. All right, so I'm going to open with this little bit right here. And Dr. Molly, I don't know if you're aware of this or not. The world's richest woman has apparently opened a medical school in Arkansas. She's one of the Walton heiresses. After having a car accident herself and having difficulty with her care, she has seen the need to come back to what we're talking about, ways that actually provide health care, not just sick care, everything from the whole person, how they think, how they live. Now, I'm a little cautious about that because the last thing I want is doctors intruding upon our lives or punishing somebody who may not have a healthy lifestyle. You know, if you didn't get certain vaccines in 2020, 2021, 22, 23, you weren't apparently allowed to have a transplant or a surgery or a procedure that you might need. I don't remember us ever telling smokers that they had to quit smoking to have some procedure, or a diabetic, if they had a dessert, they would get their care. So I have a little bit of caution on this type of thing, and even the digital records of our healthcare and government control. But I do think, as you're talking about, we need to take that overall look. Have you heard of this new health school called Awesome?
I have heard of the new health school. I don't know a ton about it. I'm a little skeptical because Arkansas was one of the states that continued to offer transgender care to minors.
Okay.
And where did that come from? Where did the political pressure to continue that practice come from? I think we need to look into that and understand what the true motives are. And there are a lot of people who put the words integrative and holistic on their door that are no such thing. It's just window dressing. You see a lot of integrative cancer centers at major academic centers. It is not integrative at all. They allow for massages and music therapy and things like that. But you ask about ivermectin or IV vitamin C, and they look you blank in the face. So I would want to know more about what the content is, who are they including in education, and is it the leaders in truly revolutionary health, or is it the same nonsense with window dressing?
I so appreciate that. And when I heard who it was, I had a bit of concern myself politically, what their stances were on some of the issues. I'll just read this one. It says, medicine in the U.S. has long been incentivized doctors to respond to people's symptoms by ordering many rounds of tests and procedures, to name two cost-driving examples, rather than try to prevent them in the first place. So we'll leave it at that. But yeah, I just thought that was interesting. And we've got to change it somehow. This is so big. We talked to politicians about the high cost. In the election in 2024, this was an issue. People were concerned about healthcare costs. And I didn't pull up the figure right before I came on, but bankruptcies, I think medical costs are maybe the third leading cause in bankruptcies for families. So we need care, although when I see the politicians are supposed to be the ones to fix it in policy, but I see the big amount of money, I think it was 600, it has to be more than a million. Is it 600 million that insurance companies spend lobbying? Are we ever going to see it change?
Yeah, that sounds right. I think they are like a 20 or $30 billion profit a year. So I'm sure that would be quite reasonable for them to spend. Again, healthcare is tricky because it has the humanitarian piece. So it can never be just a straight business model. It's never going to be a straight capitalistic, because you have the human component. So that's what makes it so tricky. I don't have all the answers, but one of the disturbing trends that I'm seeing is the monopolization. So what I mean by that is I'm outside of all of the systems, and I've now had 3 instances where I've tried to refer patients for specific services. And the knee jerk we get from that entity is they have to see one of our doctors to get their foot in the door with us. So this was a gastroenterology referral in the Des Moines market. This was a psychiatry referral in the St. Louis market. And this was the University of Iowa. It was someone in Iowa City. It was not the university, refused to do a procedure on one of my patients. So these things have to, like, the patients need to understand, if these groups monopolize, you're going to have to play by their rules to access these finite resources. This is where dropping out of the system and investing in not necessarily my clinic, but all of the clinics. We need specialists of all kinds outside of the system that can provide care. Otherwise, if it's only under one roof, they're going to control things, and they're going to make the rules, such as organ transplant. You have to have a COVID shot, which is ludicrous for a multitude of reasons. And this is what's wrong with a one-payer healthcare system. And we saw it in COVID. If you don't get a COVID shot, you're not getting care. You're not getting ivermectin. You have to go outside the system to do that. So I think more and more people understand it. They don't know what to do to fix it.
All right. So along with that care, when we hear that anybody's going to get medical care, when you go into an ER room, anybody's going to get medical care. But as you're saying, if you're not in the system, you get shut down. How does that mesh?
I ask it again. It cut out.
Well, we're okay. We're told that anybody in America gets medical care, no matter your race, no matter your status, legal or otherwise. You're going to get medical care if you go to an ER room or go to a care facility, and they have that on the door, on the walls. And yet, I've seen and you've seen where people can't get in unless you go through a series of doors, gateways to get to the specialist you want, and it costs you 3 or 4 other doctor's visits. If you have a copay, it adds up. So how do we get around that? If it's supposedly anybody can get it when they walk in, why can't those of us who are paying insurance and in a network not get it?
Yeah, this is why I'm raising the red flags on this, because this is going to become a bigger and bigger problem, because there are so many different directions. Now you have to be contracted under an insurance to access the network, and you have to be in the network to access the specialist. They're making their own rules outside of the law, and patients need to understand this. So if you go to the ER, you're going to get emergency assessment and evaluation and treatment. So that's under the EMTALA Act. You're not necessarily going to get a scope unless it's emergent. So they only have to assess and stabilize those patients. So if you have a bleeding colon mass, unless you're bleeding to death, they can bounce, I've assessed you need a colonoscopy, but you're going to have to get into that system another way. So this is pretty counter to what I've encountered, prior to this. These practices wanted patients. They wanted to take care of you, but they're telling us they're so busy they have to be selective, and they're choosing their patients first. So I'm not sure that
we didn't even get into the patients who are in the ER sitting in the hallway. They don't get a room anymore. They don't get admitted to the hospital. They are in the ER room for 3 days, 4 days. And as I hear, the hospital has the furniture, they have the rooms. It's not necessarily having the staff. So I don't know if it's a cost-saving measure there or what it is, but there's still yet a lot to unfold here and to dig back. And I thank you being in the healthcare profession to bring this to us and to open the discussion up for us. We're not saying we have the answers. We're saying let's investigate and find them together. But it's going to take we the people. It's going to take all of us as the voters and the donors, the dollar to stop some of this. Dr. Molly, thank you for joining us today. We are out of time. A great topic. I so appreciate the work that you're doing. starlightinitiative.org.
Mm-hmm. Yep. And follow us on social media if you want a ticket to our event or support our works. We really appreciate it. It'll be a fun night. So thanks again, Tamara.
Appreciate everything you do. Appreciate your compassion for your communities and just the health care that you provide for those who can come to your clinic. To everybody out there, we tell you to live boldly, love better, laugh bigger, be encouraged, and never be complacent.